when male plastic surgery goes wrong. Let's talk about it. As you probably know, plastic surgery is a largely female game. 90% of all plastic surgical patients that are aesthetic plastic surgical patients are women. But for that 10%, we are increasingly seeing a normalization of men getting plastic surgery. But recently, there was an interesting BuzzFeed article that looked at 7 famous men who have gotten plastic surgery, quite obviously, I might add, and who regret it. And so what that exposes for us is a blind spot that we as plastic surgeons need to examine closer. And that is why male plastic surgery and when it goes wrong. So for example, Mickey Rourke, who is a famous movie actor, recently came forward and was very explicit when he said that he wanted to get plastic surgery to fix the imperfections that had been created from years of boxing. But looking back, he regretted it, stating, "I went to the wrong guy to put my face back together." Simon Cowell reportedly told The Sun in 2022 that there was a stage where he may have gone too far with facial fillers. "I saw a picture of me from before the other day and didn't recognize it as me, first of all." Jeff Lewis of Bravo celebrity fame also has commented that what happened to his face was the filler from 20 years ago migrated into both sides of my upper lip and created like 2 balls. And even Kenny Rogers has said that he regretted getting plastic surgery trying to hide himself. To be frank, these are largely older gentlemen who have gotten plastic surgery, fillers, actual operative surgery, and think they went wrong or maybe a little bit too far. And so again, it exposes the question, it went wrong, but why? Why did it go wrong for these guys? And why does it go wrong for a lot of men? So let's think about this. So one consideration we have to make is facial aging and what that means. I've said in the past that facial aging is not just kind of loss of elasticity of the skin. We don't have that bounce back. And so we have some skin that hangs, but it's also loss of facial fullness. And so as we get older, our faces become more angulated than before. So that's true of men and women. And when women have that issue, they get filler or fat grafting to the face to increase facial fullness, and then they think about a neck lift or a facelift to address that. And usually, by and large, if you've seen a woman that has gone to the right person for a facelift, they look amazing. They look refreshed. They look rejuvenated. Our most recent example is Donatella Versace. If you've seen her over the years, you know that she had a major transformation recently where she looks youthful, she looks rejuvenated, she looks refreshed. She looks good. But then compare that again to a Mickey Rourke, where he for many years looked, and even Kenny Rogers looked, pulled. So you have that consideration. And then you have the consideration that there's the saying out there, men typically age like fine wine, right? As they get older, they look more manly. And what does that mean? Well, it's the same thing that we've been saying doesn't work for women. Loss of facial fullness. As a man gets older, his face gets even more and more angulated. And that actually makes him look better and not worse, typically. There is a tipping point where that loss actually makes them look really gaunt in the face and old, and it can look very old and aging. But for the most part, when you think of a man, when you think of a rugged man, right? So, I'm dating myself, but back in the day, Burt Reynolds was the man. He was very good looking. Think about him as he's gotten older and what's happened to his face that's made him look even better. Think about Denzel Washington. Think about these men. Think about more recent examples, Morris Chestnut over the years, and what's made him look increasingly appealing compared to when he first came out. Method Man. There are so many examples of men who are aging very well. The prime reason for why they look even better now is that they are losing, to some degrees, facial fullness. And so their face ends up looking more angulated, which makes them look more mature, more refined. When you think about the Kenny Rogers, Mickey Rourke, Simon Cowell, Jeff Lewis examples, look again at their pictures and see the difference there. As they've aged and have gotten procedures done, they have increased facial fullness, yes, but in a formula that actually works best for women, but doesn't really translate when you try to apply that to a man. So almost, look at their pictures again, their faces look a little bit more feminine than they did before. Yes, they look a little bit younger. Yes, they have more facial fullness, but that actually isn't necessarily the recipe for a man. The primary reason that I think that plastic surgery can go wrong for men is that we have all the great formulas for how to make a woman look amazing. After kids, after aging, after weight loss, name it, we have it. And for those of us who can't pivot to thinking about actually what makes a man look great when he's 50 or 60 versus when he's 30, it may be that, yeah, he needs a little bit more facial fullness. Maybe he needs his skin to look a little bit tauter or not as saggy. But if you lose that completely and you try to recreate what he had in his 30s and his 20s, what you may end up doing is actually feminizing his face and making him look really, really awkward and obviously operated on. So is there a message here? I don't know. What do you think the message is? Because the message could be, if you're a man, don't get facial plastic surgery, leave well enough alone, and maybe that's it. Maybe that's all. But I think really the message is, if you're a man and you're thinking about getting facial plastic surgery, you're thinking about getting filler, Botox, whatever, you need to examine with your doctor what makes and what has made you look good over time. And really, the idea is to really enhance and really broadcast and highlight those features that have made you look even more handsome and age like fine wine as you've gotten older, and then try to minimize softly, not aggressively, those features that you think make you look a little bit older than you want to. So if it's a facelift you want, get that facelift. But talk to your physician about not being so aggressive with the pull, because that could erase what makes you regularly handsome. As always, leave your comments and questions below. And as always, love you lots and bye for now.